Welcome back to another episode. Today we will be discussing some extra tips and tricks in order to make your life easier while using Dhanwantri. Today we will be discussing in regards to inpatient management or outpatient management, how to use frequently used packs or order packs. So we go to ASIC gateway and then we log in using our credentials. I'll show you what difference it makes initially and then we'll go ahead with how to do it. So suppose I open this patient. Now, since I'll be having to write down all of these medications again and again, I have these investigations again and again that I have to enter. So I'll have to enter individually for each medication, like pantoprazole, I'll have to enter. Okay, pantoprazole 40 mg. The drug dose is 40 mg. Okay, 40 mg duration for 1 day, OD. So one number. It is oral, and then clicking all of this, and then updating it daily for each and every patient can become really hectic. So one of the ways you can use is you can go for last 10 prescriptions, and then you can see whichever last prescription was advised. So you can select that, and then you can update from here as well. Another way of doing is to go to FUPs. FUP stands for frequently used facts. Within these frequently used facts, as you can see, within this account, all of these are already saved. So if suppose I choose ondansetron over here and I select, you can see it is already updated. So ondansetron is there 4 mg for 5 days, twice daily, and the route of administration is oral. The same stands for stays for investigations as well. If you have FUP investigations, you can see it's there already over here. CBC and then MRI pelvis with contrast, without contrast. If you select over here, it will update over here directly. The same stands for surgeries as well. So for medications, investigations, and surgeries, you can save a lot of time using either these FUPs or these last 10 prescriptions. Now, order packs is a pack of items that you have saved. So it can be like you can say like post-operative day one pack. Within post-operative day one pack, these investigations should be sent for the patients, and these medications should be given. Once you save that within the system, you just have to write day one, for example, and then if you click on order packs, the order pack comes, and once you click on it, and then it will update directly. We'll be seeing how to do all of that. So we'll close over here. We'll go to our clinical records, and then you can see over here we have frequently used packs, we have order packs. So if you go to frequently used packs, you can check whichever you want to use. You can do it in diagnosis as well. So you have investigations, medications, surgeries, and diagnosis. Within medication, if I want to add something, suppose I want to add pantoprazole IV, which might be not there. See, this is oral, which is there over here. I want to add IV as well. So I'll click on the search button over here, and then it will open a new pop-up. Within this also, if I click search, I will write pantop. Suppose I wrote pan, and then it will search. So I have over here, all of these are tablets, but if I go down, it's actually Pandostar, if I remember that. Okay, that is not there anymore. Suppose I select this pantoprazole. Pantoprazole already exists. So suppose I check something very vague like prednisolone. So I go for prednisolone. And within this, you can say over here, this is an injection form. And if anything is not mentioned, it's probably a tablet form. So I will choose this prednisolone. And once I select over here, it will show up. I have to fill all of this. So the generic name is prednisolone, so drug we don't have to select. The dosage we will select. Now, prednisolone, suppose I want to give 10 mg to a patient. So 10, you can search from over here and I can write mg for this patient. The frequency will be, suppose I want to say once, not once daily, just once, one dose. And the duration I want to give for 1 day. Schedule you can type for your own. You cannot keep it blank, so you have to type something. So you can see people either type 0 or 1, it depends on you. Proper scheduling of drugs, you should type over here, but it's just for stay safe. Administration route, I can say it is IV. So see over here, intravenous is available over here. Total strength, I'm giving 10 mg, so I can set 10 mg. Sorry. All right. Within remarks, if I have any remarks, I can write over this. And once I click this tick button, you can see prednisolone has been added. Now, if I open a new tab over here and see whether it has been updated within a patient or not, when I go to prescribe for a patient, we'll see that it has updated instantly. If you click on update over here, then it will update. You can see the status is new. Then if you click update, it'll take some time, and then we can see that the data has been modified successfully. Now, once for this patient, if I update this as well, this browser, if I go to prescriptions, since I added this new medication, it should be within the medication column. And I do not see it over here. I'll refresh it. And you can see it is over here now. Prednisolone is available. So I can click prednisolone, and you can see over here it is 10 milligram for 1 day, once daily. And you can see this discrepancy is there. Here it's showing quantity, whereas over here it shows the total strength. So that mismatch is there. So you can understand that the total dosage strength means quantity. So once you've done that, so I understood that I have a mistake, so I can edit this. I can edit this and I can say the total strength is actually not 1 mg, it is 1 vial for this particular thing. I'll write 1 ampule, right? And then if I click tick again, and then again it will show status as you can see updated. And then once I update, the frequently used pack is updated. Now, of course, the initial setup will be a bit time consuming, but then when you think of the long term, when you have to do this for hundreds of patients during your entire course, or if you're doing PG for your entire 3 years of PG course, you can see how the seconds add up to minutes and hours of safe time. So this was frequently used packs, and we'll be seeing order packs now. Order packs are absolutely favorite, one of my favorites. So within investigations, you can open an order pack. You can search for existing order pack, or else you can create a new one. So investigation, suppose I want to create a new order pack for say fever profile. So I'll just add only one or two investigations. You can see we have CBC routine. I selected that. I added that. The quantity, I'll say one. I added that. So one CBC is there. Medication, I will add one PCM in this. So paracetamol is there over here. The dose will be 650 mg. The frequency, suppose it is OD once a day. The duration 1 day. Schedule one. Administration route is oral. And we are prescribing only one tablet, one number. Number. All right. I click that. So now I have one medication and I have one investigation over here. And then I will save this as I will save this as fever. So I save it, the data was saved successfully. Now if I search on order packs, if I click on this little search button and I search for fever, I can see I have an order pack which is known as fever. Once I can see that it has one medication, it has one investigation. The same thing you can do for surgery as well as diagnosis as well. Now, since all of this is updated, I'll click on update again. The data was modified. I'll go back to the patient prescription side and we'll see how it actually shows up. So inpatient emergency, and then suppose this patient, Tabriz Alam, has been suffering from fever, so I want to send a CBC as well as prescribe him a 650 mg paracetamol to this patient. So within this order packs, if I write fever and see, okay, fever is there over here, the one that I added. So you can see it updated directly. You have paracetamol over here and you have CBC over here. Again, for this as well, you will have to find out what are the different investigations that are supposed to be sent for a particular disease or whatever, or on day one of surgery, what all medications it's supposed to give to a patient. And it's not like it's written in stone. If you want to change for a particular patient, if instead of 650 mg once a day, you want to give twice a day, you can just edit it. And it is much faster than writing all of these, filling all of these again and again for a particular patient. So again, as you update prescriptions and all, you can put save and close and then it will update. So that is how you save time using frequently used packs as well as auto packs. Thank you. I'll see you again next time.